Okay, hello all. I figure since I'm walking through um having to choose Penny for my family, that I would kind of walk you through what my process is. So I'm just gonna do like a quick, hey, this is the plans, blah 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 blah. See what's out there. Let's see, we'll start with health. Uh, oh, here, let's see what happens. I'm kind of playing around with this. I usually do this for clients. Um, and I usually take a look at what the plans are to see what, what's available. As you can see, they start off, so I have it set up here. This is the default setting. And they usually show you, it depends on the setup, right? So I'll go PPO because that is my preference. And as you can see, once you do PPO, and this is the reason why a lot of people don't do PPO, right, is because that was a significant price change. This is almost double what that other one was. However, I have a preference for PPO because I personally don't need to be told by my physicians who and where and what. So let's go through some of these. I'll do like a really quick explanation as to why I would go in one direction versus the other, what I look for when it comes to pricing and things of that nature. And keep in mind, this is the state of Pennsylvania. Some states have very different providers offered. Some have similar providers. As you can see, like once I did PPO, I got rid of Ambetter is one of the newer insurance companies here in Pennsylvania. Some people like to go with new. I know that Highmark, because it is a part of Independence Blue Cross, has a large acceptance network when it comes to physicians, both specialists and generalists. And so I like to go with what's going to offer me the most opportunity to support my health. And because I use alternative methods for care, I also will do a PPO because a lot of times they'll have out-of-network benefits. All right, so we have Highmark. They give you all these fancy names and blah, 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 blah. I take a look at a couple things. I like to look to see what the options are just initially. And then there's 2 pages of this. Excuse me. And let's see. Right, so then you kind of get the higher end ones. What I didn't see. Okay, so these are the out and out options that are there. What I avoid, let's start with this high end one, these 2 right here, right? Actually, I'll throw them in a comparison so that they're the only ones that we're looking at. And then I will come back to the rest of them in a second. All right, so these are 2 quote unquote estimate expensive high plans. One is silver, one is gold. The pricing is, they're both in the $1,600 range per month. You can look at the doctor facilities. They're not HSA compatible. Choose your doctor, blah, blah. So let's start talking about actual out-of-pocket costs. So there's a deductible with the just flat 1603. There's no deductible with the 1604 for both individual and family. There's no deductible for separate drug deductible, out-of-pocket max. You're really not making too much of a difference here, right? Let's start talking about, let's take a look at doctor's visits. Now, here's what this is what I'm doing for myself, for my family, as well as for clients. If you're paying $1,600, you should not be paying a $75 copay. I think that is utterly ridiculous. I usually look and I'm paying an additional $81 a month to save a $75 copay, but that's a big difference. You have to know what your financial resources are going to look like. You do eventually save, like the specialist visit, you save them $10 here. Other practitioners is a $30 copay. Any preventative care is no charge for both of them. When you look at testing, again, there's a $70 copay for that. There's no charge under this particular plan. And then X-ray and diagnostics is a nominal difference. CT, MRIs, I'd say that's a significant difference. It depends on your financial situation. Generic drugs. Now, there's no copay for generics here, but there's a copay for generics there. Preferred brand is $30, where it's $100 over here. Again, when I start hitting these price points, and I'm paying upwards of $1,600, $1,700, $1,800, for me, paying this amount in a copay, and again, I'll keep it real. I'm coming from a place of using, my ex-husband's employer insurance, which was the one that I chose for us, was a significant difference. These are out of pocket, you're doing it on your own type of things. But I'm just saying, from a conversational standpoint, I'm paying damn near $2,000 for insurance. I should not be paying $100 copay for preferred drugs. Really, not even a $30 copay for preferred drugs. And then they start talking about your co-insurance here versus $150 copay there. Outpatient facilities and care, $275 copay after your deductible is met, $300 copay, period. ER urgent care. I always recommend that my clients look at this, because this is really important. You don't want to have to be in a space of, do I go to the ER? Do I not go to the ER? Versus, and ERs are not my go-to. I do not recommend that you use the ER unless it's an absolute emergency. I always recommend having a on-hand provider for a multitude of things, depending on what your life stage is. Providers will, depending on their office availability, get you in, and then you still have that level of continuity of care. When you go into an ER, you don't have a continuity of care. They're literally dealing with whatever that issue is, and then you still have to follow up with your provider. So my recommendation is always go to the provider and let them recommend the best place for you to go, right? After you go to the provider. Urgent care, the copays are significantly different, as you can see. Hospitalization, and I think mental health benefits, I'm gonna get to that in a minute, are very important. As you can see here, there's a $500 copay for inpatient hospital after your deductible, and then this is $750 per day, deductible met or not, right? Because there isn't really a deductible on that one. I remember that now. Inpatient physician surgical, $10 copay, and then this is 20% of your coinsurance, which means that they'll pay like 80%. The mental health benefit, like I said, I really believe that this is something that's important to take a look at. The copays are different by like $10 here and there, but the inpatient services are similar to ER. Let's just go back up. Urgent care. ER urgent care type fees. Substance abuse disorder, outpatient, you have a copay. Inpatient services, you also have a copay. Pregnancy is not applicable for me. But if it is something that you're interested in, I always recommend that you at least look at what the supposed benefit coverages are. That way, and I do have teens, so I would look at the dental coverage, because those come automatically most of the time with health insurance now in our state, not necessarily in other states. So they'll cover the eye exam, they'll cover glasses, they'll cover basic dental care, checkups, major dental work. There's a 50% co-insurance. And then I would have to get a separate dental plan, because of course adults not covered, but the child has some level of coverage, or the dependent has some level of coverage. So those are those two. They're pretty, like I said, they're pretty costly. And again, the level of coverage based off those costs is really, really high, relatively high. Now, when we start looking at some of the lower end plans, and this is just a brief, right? You have an out-of-pocket max. So you have one with a deductible and then one without. And then you have an out-of-pocket max, which it defines for you. And there's a $1,000 give or take difference between the out-of-pocket max. Things I look at. It was just reminding me, because it's just me here. Some of the other things that I look at, not, like I said, not just monthly costs, but like those copays, the deductible, the out-of-pocket max. When you look at some of the lesser plans, as you can see here, there's no charge after your deductible, but what is the deductible? Well, the deductible is $17,000. If you have someone who has a lot of care needs, you'll probably hit this relatively quickly. But if you're like the majority of us, I would say that this being hit, for when I've seen with clients, it's taken, if not over half the year. So like 2/3 of the year, you're trying to meet this. You still have this, so you have some benefits for like preventative care and stuff like that. But it takes you a minute to meet this. And then after you meet this, that's when all of this kicks in. So you're not just looking at what your monthly premium is going to be. You want to really start looking at what are the out-of-pocket costs that I'm going to have. And let's just click on this one, for instance. Actually, we'll do a comparison because that's 14. I'll do 3. Same. Okay, so this has dental because I myself need dental. And bum, bum, bum. Yeah, I try to avoid deductibles as much as possible, just because. Alrighty. Okay, now we have all of these are medium estimates. One's a bronze and 2 are gold PPO. So one's a gold premium with adult and dental and vision, and the other one is just a gold with adult and vision, right? So there's not too much of a difference there premium wise. As you can see, the estimated expense, doctors, you can look that up later. Close some of these so I can actually, there we go. Close that. All right, let's take a look. Deductible, the lower end one is the only one with an actual deductible for individual and family. Included in the deductible are the meds. Under this one, there's none here. Out-of-pocket max is going to be about $8,900 for one person and almost $18,000 for a family. $6,500 for one person, that doubles for the family, and the same here, right? When you start looking at doctor's visit, no charge after the deductible. Well, we know that that deductible, if you are a family, is going to be $18,000. That is a significant out-of-pocket cost that you have to meet before you get any other additional coverage. Copays. So, and what this means usually is, because the doctor's in network, what's going to happen is you'll get the in-network price, but you'll still be paying out of pocket for that. So let's say the doctor usually charges $175 for a regular annual. That'll go towards your deductible. You're responsible for that $175. Well, I'm sorry. Let's say they charge $250 out of pocket. Because you're an in-network user or end user, it'll charge you $175. You're still responsible for that $175. Now, that $175 that you're paying the provider goes towards your deductible. However, that's $175 that you have to come out of your pocket with alongside of that premium every month. So this is why usually my preference is, let me have a copay that is feasible, affordable, even if I have to pay a little bit more per month, because that also gives me a different type of coverage and even a different type of planning situation when it comes to my finances. So there's a lot that goes into this. Preventative care, no charge for any of them because they really aren't supposed to charge you for preventative care anymore. As you can see, lab, $30 copay, $40 copay, imaging and CAT scan, 300 and $350 respectively. Generic drugs, no copay. Preferred brands, there is a copay. Non-preferred brands, there's a copay. And then specialty drugs, there's a co-insurance. Outpatient facilities, there's a copay. Urgent care, the copays are actually significantly lower here, which I find very interesting because these are lesser plans. They're lesser premiums for each plan, which still provides you, from my perspective and my recommendation, a much better copay price than I was seeing with the higher end ones. And that's the thing that you really have to pay attention to, right? Because when you have a high end copay, a high end premium, there are times when you're like, okay, I have a high end premium. The out of pocket cost should be less. And that's not always the case. So I do like to bring my clients in and have them take a look at these proposed coverages and costs prior to deciding which direction they want to go in. And we usually will talk about how this could be used and what that looks like and how that's different versus what impact that can have. So those are the discussions that I'll get in with my clients as they're kind of looking and talking through. Mental health, again, I think anytime anybody's looking for insurance, mental health and behavioral health benefits are imperative. We had this conversation. Pregnancy, I'm gonna skip right over that. And then the coverage of my children, my teens, the dependents. As you can see, with vision, no charge, with dental, 50% co-insurance, because there is some level of coverage. So what would happen here is this would be a primary insurance, and then any dental coverage that I would get would be a secondary insurance. So they would hit the primary first to see if the primary covers it. Sometimes the primary is going to deny it, sometimes not. If the primary denies it, then the provider will then go to your secondary insurance and bill the secondary insurance. So that's how that works. There's a primary and then there's a secondary. Any major dental work, so all of this is covered with the exception of the adult, right? Because I already know that. And then if I want to, I think I can click on the actual plan and go into it. Maybe, maybe not. All right, let's go back. Gotta love Pennie. So that was a 14 one, right? 1461. Okay, so then let's look at the details. Or deets, as my kids say. Teens. All right, out of pocket max 13. Yep, so that's right. So then all of this has already been reviewed. Just making sure I don't miss any. Diabetes, education. Okay, so this was the other thing. So they didn't really get into this in that comparison sheet. But then when you start looking at the actual details of each of them, they kind of break some things down for you, right? So skilled nursing facility, outpatient rehab services they offer, home health services they offer, hospice services are offered, acupuncture is not covered. Sometimes you'll get alternative care covered, sometimes not. Well baby visits, allergy testing, diabetes education. So this one in network has no charge, whereas out of network is not covered. Nutritional counseling, no charge. Children's dental, we went through all of that. I would just want to see if there was anything else that was missed. So now before I conclude here, I want to hit the back button because I want to share something. So where is that? Really, those expensive plans that were pretty much $2,000 a piece. All right, I want to go to gold. All right, let's take a look at the details of the gold one because that breaks that down a little bit more. And then family out of pocket. Here we're running to the additional services mental health benefit we already went through, pregnancy. Okay, here we go. Now the difference here, right? Home health 150, outpatient 65. So there are coverages there. Still not covering acupuncture. Hospice, there's no charge for hospice services. Allergy testing is there. Diabetes education, no charge, no charge. Okay. So, I mean, I would have a really deep conversation with my clients about why they would go with the more expensive of the premiums versus the lesser premium with a similar coverage. And it may be something along the lines of they may have, doctors that they want to stick with that are accepted under that higher end plan than the plan that's at like 14 something. So there's a couple of conversations that would be had as far as how that would play out and what that would look like. And it is definitely very individualized in what we talk through and how it can be used and what it may look like being used versus not. So that was just a really quick overview. It's a really quick talk through of how I use the information that is provided by the healthcare system, by the platform. And then, like I said, in conversation with my clients, I talk through how they're using how they've used and then how they're going to use it, because from a nursing perspective, I have an understanding of what that looks like once you're once you're in the system, versus what it is that they're proposing. And there's a deeper dive that I usually do with my clients as far as looking through different documentation and everything once they've chosen their plan. But this is me sitting and having a conversation with them about, okay, what did it look like when you did use what you had or where you were coming from? Let's talk about how that could be supported with this plan that or this particular plan that you are looking to move into, how it can help, or what detractions may be found, and then kind of talking through some scenarios and situations that you could quite possibly run into. There are definitely a couple use cases and case studies that I'll share with them and we'll talk through to better understand. And yeah, that's just, like I said, a quick overview. So hope that was helpful. And I look forward to hopping in and doing something more with you guys later. All right, bye.